Hello again, Dr. Anthony Gonzalez here with Miami Community Health. We're here with another important health topic for you today. We're actually going to talk about something that I don't know a lot about. It's really another area in medicine that patients really obtain a lot of care in, and that's chiropractic. We are going to talk with a chiropractor today. We're going to talk with Dr. Holliday today, and we're going to talk about chiropractic. So welcome.
Hi, thank you. Thanks for having me.
Well, tell us a little bit about you and how you got into chiropractic.
Okay. Well, I've been an athlete my entire life. I played college volleyball, and you get aches and pains and things coming here and there. So chiropractic was a good option for just keeping me healthy and maintaining my body. And when I became of age to determine my profession, it was between that and dentistry. And I did a few interns in both fields, and chiropractic seemed like something that was kind of likable and lovable and something that I could pursue for a long period of time. So not anything. A lot of these students that were in chiropractic school had these like miracle stories from it, but it just helped me get through my athletic endeavors. So it was cool.
So you were first a patient before you became a chiropractic.
Yeah.
Is that right?
Yeah.
All right.
Sure.
And so it helped you personally.
Yeah. It just helped maintain me and kind of keep me, off the bench and on the court. So, which was helpful.
Well, everybody wants to be off the bench. Nobody wants to be on the bench. So, and then are there ideal patients? Do you always have to be an athlete to be a good chiropractic patient, or is this area and this type of treatment appropriate for couch potatoes?
It's appropriate for anybody, honestly. I mean, chiropractic deals with the spine, so anybody with a spine can get seen by a chiropractor. I guess you could say that, but there are ideal patients, of course, back pain, neck pain, things like that. People with structural ailments or injuries is helpful too. But you don't have to be an athlete. You can be a couch potato or a weekend warrior. Those work as well.
Okay. And so, and is your practice a little different than the everyday regular chiropractic practice? Because, for clarity here and transparency, we're a little late because you had an emergency. And how is it a chiropractor has an emergency? So tell us a little bit about your practice and how it's different than a regular chiropractic practice.
Yeah, of course. So I do a special technique in chiropractic. There's different ways you can adjust patients. So we do a technique called NUCCA. It's upper cervical. So it's a lighter, more specific adjustment that analyzes the top portion of the neck. But we also do decompression therapy, which is a special machine that we have in our office that stretches the discs in the spine, the lower spine and the neck. And, people can injure those pretty quickly and not be able to walk or move. And so then they'll call me or get carried into my office, and I have to, deal with that situation then. So that's kind of a chiropractic emergency. When a patient throws their back out and can't move, they will call me and, crawl into my office or whatnot, and we'll try to get them back on track ASAP.
So I guess it's a little different than me, because when I see the patients in the office and they need surgery, they have already, gone through YouTube, and they really won't try surgery on themselves or their family. But I guess people do try things at home. There are some YouTube videos on how to do chiropractic at home.
Oh my gosh. Yeah. YouTube is like blown up nowadays with chiropractic. Everybody's posting these, different chiropractors are posting these videos of like adjusting patients with towels and like pulling their head really hard and things like that. Those are quite crazy, I think. Honestly, they're not very safe maneuvers, but people will try them at home. I had friends the other day. They're like, "Oh yeah, we bought this thing online and we tried on each other." And I was like, "That is insane." So
wow.
Yeah,
so
don't try those things at home.
Don't do it at home.
Yeah, if you can
just like
it.
You won't do surgery at home, don't do chiropractic at home either.
Right, I agree. Yes, please.
Wow. So you obviously, the patients you see are people with back pain. Of course, everybody has back pain or neck pain, right? And so what are some of the common ailments that somebody will come with? And talk us through how somebody, when they come to your office, what they would get when they come and see you. Of course, a history and a physical examination, but let's go through that, and then what the treatments are like.
Sure. Yeah. So most patients do call with an issue, whether it's a neck pain or a numbness and tingling in their arm or hand, or their leg and feet, low back pain. Headaches are a really common one as well, that people will seek treatment for. Vertigo is another good one. So they'll usually call the office. We'll speak to my assistant. We'll set them up with a first-time visit. And again, that's a consultation with me, an exam. We do computerized nerve testing in our office. We do 3D spinal x-rays in our office. I do calculations on all of those. So it's a very detailed examination for that patient, posture assessment as well, to kind of see if they are a candidate for chiropractic. Not everybody is a candidate, so we do want to make sure that we let the patient know before they receive treatment. if they are a candidate. And what makes us a little different is we will tell them if they are a candidate for chiropractic, how many treatment sessions would be advised for them. So they have an expectation and a goal. A lot of times when people go to chiropractors, they don't know when to ever stop or don't have an end goal with their treatment, unless they just feel better. So we try to give our patients an end goal as well and an expectation to expect results at the end too. So a certain result, whether it's 80% improvement, 100% or whatnot.
And so I would imagine there are patients that you see that you can't help, whether they don't need anything or they need something more severe, right? Is that correct?
Yeah, that does happen. Most of the time it's not because they don't need anything, because most people are usually out of alignment, kind of like just from normal stressors of life. But if it's something that I cannot fully correct or something that I'm not going to get them an ideal result, we will refer them out to somebody that will, whether that be a physical therapist, a massage therapist, a doctor, an orthopedic surgeon, a neurosurgeon. Those things we will refer out. I don't want to, take a patient and not get them where they need to go,
course, Yeah, provide the best care that they need for them. So what about this this disc injury and the people that have these disc injuries? Explain to us what that is, a disc injury, and how would you know if you have a disc injury and it's an emergency?
Sure. Yeah. So a lot of people will talk to them as like slip disc, like I slipped my disc or my disc popped out, kind of conversational terminology. But a disc is the little cushion in between each vertebra in your spine. You have them all throughout your spine, your neck, your mid back, and your low back. The most common area to get a disc injury would be the lower spine. And a lot of times they happen with trauma, but they can happen from day-to-day activities like lifting something too heavy or going to the gym and putting a lot of weight on your back. You would know you would have a disc injury from a few symptoms. A lot of times it's going to be a nerve-like symptom, whether it's tingling and numbness or burning or sensations in your fingers or your toes. It also could be masked as just generalized back pain as well. And that would just have to, be examined and fully examined properly to determine if it's a disc or not. So most likely you're going to have a nerve pain with a disc injury, numbness, tingling, burning kind of sensation. And
so that's something you can help the patients with as a chiropractor?
Yeah, typically we can. We have special equipment in our office for that. It's a decompression machine. It's like a big machine that they lay on, and it's a decompression machine. So it opens their spine, it stretches them and kind of rehydrates the disc. It does take time. Multiple sessions, but it's definitely it's a good option for patients that don't have a severe enough injury to get surgery to help them feel better and get on the road to recovery, and also to kind of hopefully avoid some surgery if that's a possible option.
Wow. And so in regard to this treatment, obviously we have other treatments, and we've heard that, when you go to the chiropractor, you should be like popped and you should be snapped. And I've had people say, and I don't let anybody touch my back because I'm very scared about that, but they get up behind you and they crack your whole back. I mean, should you be hearing pops and cracks when you go to a chiropractor?
Yeah, you can. Yeah, there's definitely techniques that do that. And we will do that sometimes in our office as well. You definitely just want to go to a professional to be popping and cracking your spine.
Not your buddy.
Don't let your friends do it. I mean, you can if it's something very basic, but twisting and pulling things, your neck and your low back can be very dangerous for the long run. So, but yeah, you can hear that at chiropractic office, and that's fine.
All right. And then is it anything that you do or that people are doing at home could be dangerous to these patients? Of course, you guys know what your limitations are as practitioners, but what are some of that kind of the tidbits you would tell our viewers saying, hey, don't do this, don't do that, careful with this, seek, immediate attention for certain things?
Okay. I think the best thing, a lot of people like to crack their own neck and their own back on a regular basis. I would say try to avoid that because that can be very dangerous to your spine. You want to avoid bad posture at all times, obviously, because posture is very important for your health. Anytime you're going to have a symptom in which you have significant pain or limitation with your movement or your function, you need to seek some medical attention, whether that be a chiropractor or a medical doctor, urgent care. They're all going to be able to point you down the right road to success, but I wouldn't, ignore pain or dysfunction.
And how often should you be seeing your chiropractor? Of course, there are those patients that you evaluate them and you're going to tell them these amount of treatment plans. But once you're better, should you be going to see the chiropractor on a periodic basis? Yeah,
chiropractic is actually pretty cool in the fact that it can be used as a maintenance option too, because if your body's in a better balance state, it's going to always function better. Just like if your car's tires are in alignment, they're going to wear out less less fast. So it's kind of a good maintenance option for many people. Most of, and every chiropractor is a little different on their maintenance recommendations. So some chiropractors will say every 2 weeks, some people will say every month. That all depends on the patient's activity level. Maintenance is a good option for people, I would say, on a monthly to, every 2-month basis to get checked and just make sure your body's not out of alignment. Doesn't mean you're going to get a treatment that day. You could be perfectly balanced and just say, good job, keep it up.
Now, let me ask you, this is in that whole, and I'm thinking about like every month or every 2 months. What about people that get massages? I mean, does the massage, is there any kind of warning signs? Be careful, don't do this type of massage and so forth that could be dangerous to the back? Because I think about that as somebody who always wants to protect my back.
Yeah.
Are massages dangerous?
No, massages are great.
Okay.
They're good for the muscles. I think the only thing is I've had a few patients say that the massage therapist, cracked my neck or something. That's probably not something that you want because that's not what they're trained in. But regular massages and any certain type of massages, those are all fine. They're all good.
So if I have an injury, and whether it be, a herniated disc or one of these disc injuries and so forth, or I have back pain, I come to see you. Is that something that my insurance company will cover? Do I need to see my primary physician first? How does that work? And in this world of chiropractic?
Oh yeah, for sure. So you don't need a referral from a primary for any type of insurance for chiropractic. So no referral necessary. Depends on the insurance plan. A lot of plans will cover with a copay because chiropractic is seen as a specialty in the insurance world. So it'll be your specialty copay. And then also depends on the treatment too. So if it's just adjustments, it's usually a different price than like decompression therapy or different therapies that the doctor might provide in their office. But usually insurance will cover a portion of some of the treatment. So it's kind of nice.
Wow.
Usually.
So, obviously you're quite busy and you see a lot of patients, and it seems like you love what you do because it obviously was a huge benefit in your personal life. But what are the biggest challenges? What have you seen in the last few years of practicing as a chiropractic has been the biggest challenge for your field?
I guess the media plays a big role in chiropractic now because of YouTube and TikTok with all these chiropractors doing these crazy adjustments. Patients expect a certain type of adjustment, which is, usually a very dangerous thing if they've been looking at those like media options. Also, there's always a fear of, certain injuries with chiropractic, that if you don't do proper exams, you're going to injure the patient. So I think patients, sometimes are a little wary of it too. So it's just about taking really good protocols initially with the patient, doing proper exams, which is what we always do in our office to make sure we're going to be safe with them and give them the proper treatment as well.
And one of the things I've learned in doing so many of these shows is that not only is it the treatment that you provide, when your case is the adjustments and the decompression, but the lifestyle is very important as well. Can you talk to us about the lifestyle and the nutrition? And, we've heard so many times from other doctors that, sleep is important and no smoking and limited alcohol use. Talk to us a little bit about that.
Yeah, lifestyle's a huge thing because, that's what determines how you end up in what state you're in eventually anyway. So the more that you can protect that and do the top things that are most important for your health, the better you're going to be. Posture is a huge part of our recommendations for our patients. We have people that sit at computers for 10, 12 hours a day, and now that working from home is such a big thing, they're not even at a desk anymore. They're on their laptops in their bed or at their kitchen counter, and their body is rounding, their neck is forward. That creates a certain stressor on the nervous system that can be very detrimental to your health in the long run. So posture is a huge thing that we try to advise patients on. We'll even go to the extent of having them take photos of their workstation and accommodating what's better for them at that time. But posture is huge. And I think that it's kind of put on the back burner. Obviously, you don't want to smoke or drink and, limit those things. But posture is another big one that can really bite you in the butt later.
So what are some of the postures that are going to be appropriate for, let's say, somebody who's on a computer? Or let's use I spend my time either standing at the operating room table, or I do a lot of robotic surgery. So I'm sitting sitting forward, looking down into a console. So what are some of the keys that you can tell our viewers? These are keys. Whatever job you do, whether you work in an office or you work in another location, always do these checks so that you're maintaining good posture.
Yeah. So if you think about like the basic of your spinal position, your spine's shaped like an S. Okay. So you have a big curve in your neck and a curve in your mid back, a curve in your low back, and you're supposed to be more like erect, like upright. So you kind of want to evaluate that. If you're sitting at your computer and your neck is looking down or very forward, try to raise your computer screen to where your neck is a little bit more neutral. Like in your situation where you're doing a lot of standing and looking down, and that's something that you can't typically change. Like in your field of surgery and a lot of like the dentistry field, they're going to be looking down and you can't really change that. You want to take more breaks throughout your day, so your body isn't molding into this forward C-shaped posture. You want to be more like an I, not a C. So the more you can move and change your position, the better. Given surgery is hard to do because you can't move during surgery or like, a dental procedure. So those are sometimes, professions that we can't change very much. So then at night we have them do exercises at home that are helpful. So if you can't change your posture during your day, so make yourself more upright, then there's things you can do at night that will help as well to try to combat your posture during the day.
Wow, that's incredible. So I'm going to take breaks during surgery. That's what I'm going to do. I'm going to just stop surgery right in the middle.
Yeah.
No,
I wish.
No, but that's very good to know. That's very, very good to know. One of the things I always heard, and we were taught for your lower back, if you have to stand for a long period of time, if you put one foot up on a platform a few inches above the other one, does that help with straightening out your lower back?
No.
Okay.
Not at all.
All right. Well,
no,
I've been doing that.
That's going to make your hips look like this.
So I've been doing that for years. That's a problem.
No.
That's a problem. Okay.
I mean, those anti-fatigue mats are really good. So there's some mats that you can stand on that are super good. That'll take some of the compression off your spine, but one foot over the other.
So standing on a soft mat will impact your spine.
Yeah. You can get an anti-gravity mat that is less compressive than standing on the hard concrete. And that's much better for you.
Okay.
Because if you think about standing with one foot up, you're tilting your pelvis, and then over time your pelvis will be tilted unless you switch it very evenly.
Yeah, I do. I do switch it.
Then that's okay. Yeah, because it's kind of like you're like walking in place.
I'm gonna have to check and see how my spine is doing.
You need to get a treadmill under the table.
Oh yeah, walking while we're doing that. Okay, so let's talk to our youngsters out there. So obviously you had some life-changing, experiences that made you a chiropractic and a chiropractor. And what do you tell our youngsters? What is the path to become someone like you? If somebody's interested in this field, talk to us about, what they should be doing as a youngster, whether it be a high school, college student, and what is the path like to become a chiropractor?
It's very similar to becoming a doctor, other than you don't go to medical school, you go to chiropractic school. There's entrance exams the same. You have to do all the classes in high school for the medical field, health science studies, the physiology, the chemistry, pretty much all those same classes. It's just you don't go to med school, you go to chiropractic school, pretty much.
And then when you're done with chiropractic school, in medical school, you go to all these specialties. You go to cardiology, internal medicine, OBGYN, surgery. Are there specialties within chiropractic?
Yeah, there definitely are. You can specialize in same, like you can do pediatrics, you can do neurology, you can do radiology, you can do neurology, you can do all those specialties. They're not as extensive. Like in your situation, you're going to, be a resident and then, go for a year or two to learn that. You'll already be licensed as a chiropractor, and then you'll be taking that while you're in practice. But yeah, you can specialize in all those things for sure.
Wow.
If you want.
Well, that's good information. And then what else do you guys provide? Do we have the information for your practice, which they'll put up for us? So if anybody has any back pain, neck pain, headaches, I heard as well. So I think I'm gonna have to send my wife out there because she has some headaches. Maybe that's the problem. And maybe it's me. I don't know. Yeah, thanks. So, besides, of course, this chiropractic care that you guys provide, anything else you guys provide in your office as well?
Those are the main things. We do have a, soft wave as well, which is like a non-invasive stem cell machine. We do that because it just helps with inflammation, just to, help with our services in regards to chiropractic. But that's it. Just
what is that? Explain that. What is that?
So SoftWave is a sound wave machine. So it's a new technology out of Germany. All the NFL teams are onto it now. And it's just, it's a non-invasive machine that you run on the skin. It's superficial. It doesn't penetrate the skin, and it helps stimulate stem cell formation within the body in the area that you're targeting. So if you have a shoulder injury or a knee injury, it'll help kind of heal some of those tissues or get some of the inflammation out and help the patient get moving better. Because if you have a knee injury, you're going to compensate and create stress on your spine, and same for a shoulder. So we do address those issues.
For the different joints. You do that for the knees or the shoulders. And so prior to that, the stem cell used to have to be injected stem cell into the joint. But now there's alternative therapy.
That is an alternative one. It's a new technology that they've created out of Germany. So Germany's had it for years, and FDA just approved it. So yeah.
That's
It's
great.
fun.
That's great. Wow. So I've learned that, you take care of the spine. It's like an S. Good hygiene is important. Of
Yeah.
course, good posture. If you've explained to that, and don't try things at home. Don't follow the YouTube.
Don't
Maybe
do cracking
we
things at home.
don't do these cracking things at home and popping, and don't let people that are not experts or professionals, pop your back or crack your back. And if you have a question, seek chiropractic care. Of course, see a chiropractor, somebody who's a professional that can, give you some good advice.
Right.
Is that a good summary of what we've learned today?
That was pretty good. Good
Yeah,
job.
you see, I've learned. Great. Well, I want to thank Dr. Holliday for being with us today. Thank you so
you.
much for taking the time.
Mhm.
We're sorry to pull you away from your emergency,
you're fine.
but you, as a doctor, patients first. So she took care of the patient. I waited patiently for her
Thank
here.
you so much. I'm sorry
And
about
no
that.
problem. And of course now has taught us. So if you need anything for your neck, your back, headaches, back pain, you're concerned about your posture, see a chiropractor. Good hygiene, good posture is very, very important. So thank you once again for being.
Thank you so much. I appreciate it.
Thank you for being with us. So once again, Dr. Anthony Gonzalez here with Miami Community Health, providing you important health information for your well-being. Thank you very much and have a great day.